are not required to submit an intent to sell form for Plan Year 27. Your Plan Year 27 training invitation will automatically be sent by the end of the day on Tuesday, September 1st, 2026, to the email that we have on file for you. If you did receive an email from us, that is the email that your training is going to. If you need to change your email address, you need to let us know as soon as possible. You can either email me or broker support. The invitation for the training will come from trainer@learn.trackstar.com, and that's from the NVHL training team. I do want to remind you that if you log into your Trackstar account prior to September 1st, it will show inactive. So just make sure that you're logging in on September 1st, and that's when we're going to reactivate your accounts. And for the new brokers, you have until August 25th to submit an intent to sell. Only submit your intent to sell once. Duplicate submissions will be rejected. The training link will be sent to the email that you provide in your intent to sell form, and only one email may be used. You will still receive the training September 1st for new brokers as well. And if by any chance anybody doesn't get the broker link, the training link, by September 2nd, please either reach out to me or broker support. Does anybody have any questions regarding the intent to sell? Hearing nothing, I'll move it on to Shay for our next set of updates.
Good morning, everybody. So one really important update that we have for you guys is that we are going to be having a portal downtime period across the board for all users. So starting on June 23rd at 2:00 PST, we will be making some really important system updates on the back end, but it is going to cause a downtime starting at 2 p.m. through the end of that night, where everyone will be unable to access any portal at any point. This includes our internal staff, brokers, navigators, call centers, call center representatives, everyone across the board. We will not be able to access the portal. And so we want to let you guys know we will be heavily messaging this and sending out reminders to brokers and navigators. We'll have banners on our website to let consumers know. And we will be making some tweaks to the call center tree to advise, any consumers calling in that we will be having this downtime so that there's no surprises to any user when they come in and are attempting to come in on the 23rd after 2 p.m. We do expect to be back up on the 24th with no interruptions at that morning. But if you guys are experiencing any issues, please reach out. We also know that this may hinder some productivity if documents are being required, or if anyone is trying to report any events for any consumers at that time. If that is the case, if you guys could please reach out to the broker support and let us know that you have this and you're needing this to be taken care of. We obviously won't be able to take care of it for you then, but at least it's documented so that we can have the accounts be updated and reflecting accordingly, because we know that this may or may not hinder workflows and timing for your consumers' accounts. So please just set a reminder for yourself that starting at 2 p.m. on the 23rd, you guys will not be able to access the portal, but starting up again on the 24th, there should be no interruptions. Going into the Nevada HealthLink portal MFA updates, we will be making some changes to the multi-factor authentication within the portal. Currently, we are utilizing Duo, and we are moving away from Duo and going to a different authenticator app. A lot of people are leveraging the Microsoft Authenticator, as that's been the one that's recommended. The majority of users have already made this change in the system. Navigators, we had a successful implementation last week. For the brokers, you guys are slated to start this transition I believe we're shooting for July 13th. So another reminder, when you guys go to log in, you guys will be prompted to set up the new MFA. A QR code will appear. You guys will scan the QR code on the new Authenticator app, and then you guys will be able to log in using that Authenticator app that is now going to be the source of truth for your MFA, and we will no longer be using Duo. If there are any issues or interruptions and you guys are unable to access the accounts for whatever reason, there's going to be a team that is ready and on to take any of those requests coming in. So if you guys could please just really leverage the broker support email and let us know that you guys are having issues, and the call center will also be ready to field those phone calls to make sure that you guys don't have any interruptions in getting logged in. But again, please set yourself a reminder for the 13th of July. And if that date changes, we'll make sure to let you know, but that is what we're planning for as of right now, to do those MFA changes. And then going into auto renewals, I think everyone's favorite annual process topic to discuss, which is right around the corner. We are getting ready to start kicking off the planning of the 2027 auto renewal process. So the process this year is going to be the exact same as it has in previous years. I know that there's been a kind of a little bit of confusion with the pre-enrollment verifications policies that have come up, and I'll let Joseph talk about that in a couple of slides coming up. But mainly what we want to just make sure that we're messaging to you all is auto renewals are not changing this year. We will be running everything like we have been previously. We will still be sending out pre-renewal notices to all consumers, and that date right now is penciled in for September 2nd. That will be sending out that initial notice to everybody, letting them know to come in, make sure their accounts are up to date, and that will be running those auto renewal processes in October. So we should be running all of the clone jobs for applications roughly the second week of October. And then that will really kickstart that process there. But like I said, the one main thing we want to take away from this is that nothing is changing for 2027. It's going to look very much look the same as it has in years past. But please continue to communicate with your clients and consumers, get their applications updated, and make sure that their applications are up to date by the time that this job rolls out, so that everything for Plan Year 27 is according to how it should be. But obviously, open enrollment will be open on 11/1, and all those changes can also be made at that time for Plan Year 27. I think that's all I had for these slides, and I'll turn it over to you, Joseph.
Thanks, Shay. So good morning, everyone. Joseph Filippi, Policy Manager for the Exchange, is going to go over a few new federal rule changes that are taking effect this new plan year in January. So last month, CMS released a final rule that will make several changes in Plan Year 27. So firstly, just wanted to go over the citizenship changes for advanced premium tax credits eligibility. So in Plan Year 27, the following categories of immigrants will be eligible for federal subsidies, including both APTC and cost sharing reductions. And that includes lawful permanent residents, Cuban Haitian entrants, and COFA migrants. I do want to say that that doesn't mean that other immigrant categories who are lawfully present currently, they can still enroll in a qualified health plan. They just won't be eligible for any federal subsidies. Additionally, the rule eliminates eligibility for premium tax credits for any individuals that were also ineligible for Medicaid due to their immigration status and have income below the 100% federal poverty level. Just wanted to highlight that as well. To the right, on the right-hand side of the screen, just wanted to go over some changes related to catastrophic plans and hardship exemptions. As many of you know, catastrophic plans offer low monthly premiums, but they have high deductibles. Currently, consumers who are under the age of 30 and others who are approved for hardship exemptions, they can enroll in catastrophic health plans. The new rule expanded the hardship exemption eligibility to the individuals who are over the age of 30. So any individuals over the age of 30 who have income below the 100% poverty line level or above the 250% federal poverty level, they are eligible to apply for a hardship exemption, and if approved, they can then enroll in catastrophic coverage. As you also probably know, I believe HR 1, the federal law that took place, it changed, it allows catastrophic plans in addition to bronze plans to be enabled with a health savings account. So just keeping that in mind, if you have any consumers that someone is trying to take the control here. Sorry about that. Am I still sharing the screen?
It looks like it went back, Joseph, to portal downtime.
Apologies. Okay. Are we back or no?
No.
Okay, hold on one second. Sorry for the technical difficulties. All right, I think we're back.
There we go.
Okay, so continuing on with the catastrophic coverage, just wanted to note that those plans can be enabled with an HSA account, similar to the bronze coverage. If you have a consumer who qualifies for the premium tax credits or cost sharing reductions, they may find better value in a bronze or silver plan. So highly recommend compare plans. Related to the failure to reconcile policy, as you know, currently Nevada HealthLink, we have a 2-year look back policy, meaning if a consumer does not reconcile their APTC for the prior 2 years, they'll be ineligible for federal subsidies going forward for the next year. This federal rule, it allows our state-based exchange to change that to a 1-year look back period. We're still making that decision internally, so no official change at this time. But if we were to change it for plan year 27, that would mean that any consumer that fails to reconcile their tax credits would be ineligible for subsidies going forward in the next plan year. So more to come. Any final changes will be included in our plan year 27 policy manual that's released in the next couple of months. And finally, there's going to be some new income verification requirements, which will be an additional, administrative burden for your consumers. Just wanted to note that we are going to be required to issue data matching issues when attested income is above the 100% federal poverty level, but that conflicts with data matching that shows that they actually made less than the 100% federal poverty level. And also we're unable to accept self-attestation when tax data is unavailable. So a lot of eligibility changes here. If you have questions, of course, feel free to reach out to broker support. We also have a new Navigator support email that we'll be monitoring. And like I said, the updated policy manual will be released in August within the next couple months. So any of these changes will be outlined in more detail in the manual, and happy to address any of your questions now or in the future. I do see a hand from Luz.
Hi, thank you so much, Joseph. Just a quick question on the COFA migrants. What does that mean?
Great. Thank you for asking. And I have it here. I thought I did.
On the first chart, on the left-hand side, top
It's
left.
compact. It's a compact of something.
It's Joseph, it's Compacts
Yeah,
of Free Association.
Thank you. Yeah, Compacts of Free Association migrants. Currently, they're one of the lawfully present eligible immigrant types. So they're just going to be one of the new one of these 3 categories that they're allowed for premium tax credits going forward. All other types of migrants, refugees, etc., they are still allowed, as I said, to enroll in coverage. But unfortunately, if they're not one of these migrant types, non-citizens, they will be ineligible for any federal subsidies going forward.
Okay. So anybody that has a work permit and a Social Security is not yet a permanent resident, they will not be able to be eligible for subsidies, correct?
That is my understanding.
That's moving for 2027 when they file taxes in 28, or is for the people this year?
So it would be for coverage that they're applying for that's effective as of January 1st or forward. So it doesn't impact the coverage that they have this plan year through the end of December 31st. But their new coverage year that starts January 1st or any future coverage past that point, they will no longer be eligible for premium tax credit.
Oh, thank you for that clarification. That's so important. Thank you so much.
It's a big change. So yes, good question.
Yes, thank you.
Any other questions related to these upcoming policy changes?
Joseph, just wanted to clarify on the last question for Luz. The work authorization card is not an actual citizenship status. That's just an authorization document. So when you're asking if they have that, if they're an LPR and they have an authorization card, they're good to go. But if they are not in one of those three categories, then yes, moving forward in 2027, they wouldn't qualify for PTC. Just wanted to make sure I clarified that because she mentioned specifically the authorization card and social security card only.
Thanks, Rosa. We have
Sure.
another hand up.
Thank you so much.
Sarah, go ahead. You're muted.
Okay, sorry, can you hear me?
Yes, we can.
Okay, and for Cuban people, because it says Cuban entrance, how they can prove if they have just a employment authorization card because they don't have their permanent resident card, how can they show or prove that they have the Cuban entrance, or I don't know.
Rosa, do you want to take that? I'm assuming it'd be the same way they show proof of that currently.
That is correct. Anyone that is here lawfully has some sort of document, whether it is a passport, a 94, a 797, something of that sort that states what status they are, whether it is a Cuban, Haitian, COFA, or an LPR. Those type of documents are what we would look at, not specifically the EAD.
Okay, but if they just have that, well, if they have the I-797, but it's for the application for the employment authorization card, or the receipt that they approve that document, or is the application for the permanent resident, which one? Because it's a lot of type of I-797.
So as long as the I-797 states that it's the approval, not of the authorization card, but the approval of the status, that is what we would be looking for. Because the I-797 is just a notice of action. It's just telling you whatever's happening with your case.
Okay, but is the approval for the permanent resident just that? Because the Cuban people, I have a lot of clients, they are here, but they didn't receive their permanent resident card, okay? They only have the employment authorization card. They already applied for the residence, but they didn't receive the approval or the card. So how can we prove that they have the Cuban entrance? Or I don't know, how can we prove that?
Can we get back to you in regards to further documents? I'll supply some documents that we look at from USCIS. And that way, maybe the broker team can share that with you and we can share it with the navigators as well.
Yes, because we need to be prepared for that moment to ask the consumers that we need these documents, because if not, they won't approve anything. So thank you.
You're welcome.
I'll make a note on that.
Awesome. Thank you for the question. Ms. Lopez, did you have another question?
Yes. So when the renewals come, you probably will be looking into those documents, right? To make that decisions to see who is gonna go through or not.
Joseph, I can take that if you
Yeah.
want me to.
Go ahead, Chip.
Yeah, so when we're running auto renewals, right, we're running everything against how the SSAPs have been filled out and completed based off of the household itself, right? So when we're looking at the auto renewals, we run those out to the federal hub sources, and when they come back and a consumer is potentially issued a DMI, right, we have the DMIs for lawfully present, we have DMIs for citizenship, and things of that nature. We will be looking at those items at that point too, but within the actual application itself, you have the questions, are you a citizen? And you would like, no. Are you here lawfully present? You would say yes, and then you would provide additional details there. We will look at also how that's answered at that point, and all the information provided there. And then like the caveat to that being, right, is if they are, the non-citizen APTC eligibility and they're under the 100%, we would just move them to no APTC at that time. So we'll be coming through mainly the part that's going to be there, right, is if you have a consumer who is like kind of like on the borderline, they don't quite qualify for Medicaid, but they're maybe like 105% of the FPL. But at auto renewals, when those FPL percentages change and now they're under 100% and they're non-citizen, you'll see at the auto renewals, it really take effect there when it comes to the APTC portion. But really, we're just looking at exactly how the application was filled out and verifying what was there, and then adding the hub checks with the federal government to issue any DMIs that may come back if the application isn't matching what the feds have.
Great. Thank you so much. That makes sense. Thank you.
Awesome. Thanks, Shay. Any further questions before we move on? Rebecca?
I just wanted to let everybody know that this meeting is being recorded. It will be posted on our Facebook with all the questions in the chat. So if you need to reference back, it will be recorded and posted on our website.
Rosa, I think we're ready to turn it over to you.
Oh, okay. Thank you, Joseph. We'll just be going over some application tips here when we're determining the household size for Nevada HealthLink coverage. And that came about from a recent workshop that just happened. So we just want to make sure we're reviewing this information. I'm sure all of you already know this. So forgive me if I'm reiterating information that you already know, but we want to make sure that even for the new folks that are on the line, that they understand this. So let me go ahead and go over the household composition that we ask for. On the marketplace, we're looking for, when we ask for household, we're looking for the tax filer, their spouse if they have any, and any tax dependents. When you're assisting applicants, we're asking you to keep the following guidelines in mind, which is again, to include the spouse if the applicant is married. There are some exceptions here. We ask that you include the applicant's tax dependents for that coverage year. This also has some exceptions. As we know, there could be some situations where a divorced family may have a child 1 year and then off the other, or perhaps a judge has ordered a parent to pay for coverage for the child, even though they may not claim that child for the year. So that's why I say there's some exemptions that apply there for the tax dependents as well. We want to remind you that if a person can be claimed as a tax dependent by someone else, they are counted as part of that household and not of their own. Do not include individuals that will not be claimed as tax dependents. Again, certain exceptions apply, going back to that scenario with the child of a divorced couple. Include spouse and tax dependents, even if they are not seeking health coverage. Again, with the spouses, there are some exceptions that apply. Do not include an unborn child in the household size. Once the child is born, the family will generally have up to 60 days to enroll the newborn through a special enrollment period. Want to make sure everybody is aware of that. The pregnancy in itself is not the SEP, it's until the baby is born. I will go over to the next slide, please. And then we'll go over whose income to include in the application. Again, when we're looking at the income, we're looking at the taxable household income. And this taxable household income will include the tax filer, their spouse if legally married, and their tax dependents, including those who are not seeking health coverage. When you're reviewing the application, please make sure to consider the income of all of the household members that are on the taxed household or tax dependent. That was it. I just wanted to make sure that everybody was aware of this information. I know most of you already know it, but there were some questions that came up on a recent workshop, so we just wanted to reiterate. I will pass this on now to Katie. I believe she's taking over the next slide.
Thank you, Rosa. Hi,
Thanks,
everyone. I'm
Katie.
Kate. I am Katie Charleston. I'm the communications officer here at Nevada HealthLink. I just wanted to give a quick update on Medicaid Express. There's not too much more to share from our last meeting, but just a kind of reminder. So Medicaid Express is just a new pathway for Nevadans to apply for Medicaid coverage through Nevada HealthLink. All other existing pathways will continue to exist, and people can still apply through Access Nevada and DSS and the district offices. It's expected to launch this fall, so in the next few months. And what can they expect? It's going to be the same as our existing platform right now, but basically, if it's income-based eligibility, they can receive an immediate determination instead of being sent over to DSS to get that determination, so we can determine them ineligible or eligible for Medicaid at the time. If they are determined ineligible, then they can go to continue their marketplace application and shop for coverage and see if they're eligible for subsidies. And if they're determined eligible, they can pick their preferred MCO and then be sent over to DSS. And again, who can apply? Anybody can apply through Nevada HealthLink. It's ideal, though, for those who are under 65 who are meeting income-based eligibility or Medicaid eligibility requirements to receive that real-time determination. If they receive an assessment, it'll be the same process as exists right now. They'll be sent over to Medicaid to complete the application. Next one. And I just wanted to share a few resources. I shared the link in the chat to our Broker Navigator resource page. That's where all of these meetings are posted, and also all of our newsletters. We also have training materials and different updates on there. We have our policy manual posted on that page as well and linked on this presentation. And as Joseph said, that'll be updated in a couple months, but that's a great source of truth for everything. We have our FAQs on our platform as well as on our NevadaHealthLink.com site, and that just goes over eligibility questions, required documents, things like that. Our call center for brokers and navigators, we have a special line for you guys. They are another great resource. And then NABIT for our brokers, if you're not a part of that. We had some questions from some new brokers for professional development. That's a really great resource. And then the Division of Insurance, if you have any carrier complaints. We have some questions for network complaints or issues with enrolling people in plans that change at the beginning of the year. So if you have any issues with carriers, make sure you're reporting them to the DUI. And I think that is all we have for you guys. And we can go ahead and open up the floor for questions. Not seeing anything, but as you think about it, if anything comes up, please reach out to either our broker support or navigator support. We're here to help you guys. Oh, go ahead, Katie.
Hi, yes, can you hear me?
Yeah, we can.
Okay. It's more so kind of not a scenario question, but right now when we do the application and it prompts, Medicaid eligible, we obviously tell them, hey, it looks like you're potentially Medicaid eligible. You still need to go finish your application with DSS. Your information is being sent. How is that really changing in terms of the conversation? Is it still just going to be hey, you're potentially Medicaid eligible and you're still going to have to go to DSS and finish that? Is that kind of still going to be the same process, I guess?
If they're Medicaid, the goal is if they're Medicaid eligible based on income, then right there they can send over a determination instead of an assessment. So basically aligning the application. So you go through, they're eligible for Medicaid based on income. We're saying, yes, they are eligible for Medicaid. Which MCO do you want to go with? And they can actually do all of that selection right there. And then the actual enrollment goes over to DSS. So it's just basically
Okay.
changing from an assessment state to a determination state is really the only difference.
Okay, so there are still, possibilities of them having to be, provide different documentation and stuff like that
Yeah.
to finish. Okay, cool. Thank you.
Go ahead, Seth.
Can you hear me?
Yep.
Perfect. Also about Medicaid, when people get pulled into the, when they do their checks and they find that they might be eligible and then they lose their tax credit, how long are we seeing that it takes for DSS to transmit the ineligibility if they're actually not eligible to get that cleared up and get their credit back currently?
Seth, I'm assuming that you're talking about like current system behavior, right? With the 90-day question change.
Yeah, with the change when they, some people will lose their credits and then because they might be eligible. I've got several people who are in that boat right now and it's been over a month and they still haven't had it fixed. I'm just curious what the timeline is to hear back from DSS on ineligibility.
Yeah, so we're looking into a couple of additional things on our end. And so if you have a few that are coming up a little over that month time span, I would highly recommend that you reach out to broker support with the application IDs for us to review, because we might be able to, see what's kind of going on and check the status of them. We typically are seeing a 45-day auto response coming from Medicaid, but we have seen some responses come in sooner, just depending on how quickly the consumer is working with Medicaid and providing them with all the documentations that Medicaid's asking from them. So there's a couple of different scenarios on the timeline, but if they're not complying with Medicaid, we're seeing those responses come in around the 45-day mark, 45 to 50-day mark. But if they are, if your consumer already has the letter showing that denial, and we haven't received the automatic account transfer yet, that would be a little bit of a red flag to us. So I would be really interested to see those account examples so that we can just make sure that everything on our side's working as designed and should be.
Certainly. Yeah, I have several of those. And my concern is people's reaction to that is just to cancel their coverage when they have to pay 2 months of, 1,000+ a month. So
Yeah.
it's an issue. But I'll go ahead and send those over. I appreciate it.
Yeah, I totally understand. And like I said, if you have a few of those and you know that the consumers already have those denial letters in hand, please send over those application IDs. We're more than happy to review those and just make sure that everything is working as designed and it should be.
Cool. I'll work on that right now. I appreciate it.
Of course, thank you.
I have a question about the look back period for income. I understood you want to change it to 1 year as opposed to 2. My concern would be if someone is applying for coverage, but they haven't filed their taxes from last year, but they had filed it from 2 years ago. It would be easier to look at the 2 years ago than look back to a year where they may not have filed it yet. That's my concern.
Yeah, no, thank you, Lynn. Appreciate that feedback. And just for clarification, we are not confirming that we're making that 1 year look back period change. We're still discussing that internally. We have the option to hold off on that until 2028 plan year, when it is going to be mandatory for all exchanges nationwide to have the 1 year look back period. But really appreciate your comment and your feedback related to just keeping it the 2 year look back as it is today.
Yeah, I did not know it was changing in 28 or whenever. So thank you for that.
Yeah, that's one of the many changes that the one big beautiful bill that passed last year is mandating. Takes effect in 2028.
Go ahead, Jetta Insurance.
Oh, yes. Hi, good morning. I have a question regarding to Medicaid income assessment. For the Medicaid, as far as I'm aware of, they assess the full income versus Nevada Health. With the ACA, we assess adjusted gross income. And some situations where the income that we indicate is adjusted gross income, adjusted gross income. So a lot of time they would go down to the Medicaid and get assessed, and then they get a full assess based on the full full income and then find their excess income denial, and then we put in the actual income they believe to be, but then if they fall under 138% poverty level, then they get Medicaid assessed again. So in that situation, what do we do? Can you hear me?
Yeah, sorry, I'm trying to follow the example. So if you are putting in the income with us and you are being assessed as under 138%, we will send you over to Medicaid to be evaluated. And like you said, right, Medicaid's going to look at what actual earned income in the last 60 days. If you fall under the threshold, you have to go to Medicaid, follow through with Medicaid's processes, get the proper determination from Medicaid, have that account transfer sent over to us as a denial. And if the consumer remains under 138% with a denial, the proper denial, we will grant them the subsidy eligibility back. But anytime that you make the application change in the future and that consumer is still under 138%, we will still continue to send them to Medicaid for assessments. And I do know that like that's been one of the big talking points is that, you know, we look at income differently than Medicaid does, but the best rule of thumb that I can really give to everybody is that if that income is under 138%, we will be sending them to Medicaid every single time until either they're over 138% or we continue to go through the process with the ATs and get the denials showing that they are excess income. And kind of, you know, like the best way that we've been calculating it is, you know, the income is provided to Medicaid and the excess income denial letter will have an income amount at the bottom of that letter. And we take that income amount and we multiply it by 12 and put that in the application. And that's been working pretty well for consumers in that sense. But again, if they're under 138% for adult magi or under 205 for children, they're going to be sent to Medicaid every time.
So because they're going there over there all every time, then we have to match with the states. So to make sure if they want ACA, then it has to be matching with the state Medicaid, correct? Otherwise, it's going to be a recycle. It's going to be a cycle if they are assessed as excess income over there, but we we adjust the income to the way that is reflecting their tax. But if it falls under the 205 or the 138, it will continue to go back over there. So
correct.
To make it less complicated, well, either they have to decide to go to Medicaid or have it above the poverty level that would not be kicked over there.
Correct.
I see. Thank you.
Thank you. Vic, I see your hand up.
Well,
If you're talking, you're on mute.
Okay, can you hear me now?
Yes.
Okay. Okay. 2 points. A couple questions and a point of clarification. As long as we have a denial from Medicaid within the last, is it 60 days? Then we're clear to enroll with the HealthLink. And it's not going to get sorted back to Medicaid.
No. So how the current system behavior is right now, if you have a consumer come on to the exchange and apply, and their income is under 138%, no matter how many days it's been, or if there is a denial letter in hand, if they are under 138% for adult magi, we will send them to Medicaid for proper determination over on the Medicaid side.
Even if we have a current denial.
Correct. If you have a current denial, that denial is for excess income, Our advice is that you are taking the income that Medicaid has put into that letter showing the excess income and using that income amount by 12 in the
Okay.
application to then show that, yes, you guys do have that excess income. It will get you above the poverty level because it's already been determined by Medicaid, and that will get you out of that loop. But no matter what, if you have a denial within even a day and you come back on the exchange and your income is at 136%, we will send you to Medicaid even if you just got the denial the day before.
Okay. Now, my question, are we kicking a can down the road there? Because what'll happen if we're counting income, if Medicaid's counting income that's not taxable, that's not going to show up on a tax return at the end of the year, are we creating a financial liability for the consumer when they go do the reconciliation on taxes?
Can you repeat the question?
Okay, if Medicaid is counting income that is not taxable and would not normally be counted by HealthLink, then then when the consumer goes to reconcile taxes on the next tax return, are we creating a liability for them because they're going to be perceived as receiving tax credits that they didn't deserve, that they didn't that were unwarranted? So we're creating a financial liability for the consumer on the tax return by using that workaround.
I'm confused what workaround you're referencing.
Okay, what I heard Ms. Herbert say was that we take the figure that Medicaid used for the denial, which may be higher than the figure reported on that was used in the application to HealthLink. Correct? And if we do that, then at the end of tax time, what's going to be relevant is the actual taxable income, not the number that Medicaid used. And so they're going to show tax credits against a different income. And I'm wondering if there's a risk for creating a liability for the consumer there. I can imagine a worst case scenario where Medicaid finds non-taxable income that pushes the consumer into eligibility for tax credits under HealthLink, but then when they go file taxes, the taxable income is below FPL, and they would wind up owing all of the tax credits back.
Yeah, so Vic, this is kind of an example that came up in a workshop that we had recently where there was some concerns around the under the threshold paying back the tax credits. And I
Yep.
think to that example, that's something that we're going to have to take back and work on internally just to see how that would affect and, maybe get some more information on our side. So I think that that's a really great question, and there's a little bit more digging that we need to do on our end to provide more substantial advice towards that example.
Yeah.
But like ultimately with this specific workaround with the Medicaid, right? At least like when we're looking at Magi, the key difference is there, and this is something that we're working on trying to hopefully get some resources for, is Medicaid is looking at the calculated earned income in the last 60 days, where we're looking at what are you making or going to make in the year, right? And that's where that breakdown really comes into play. And so again, because they're looking at the actual 60-day earned income, that's where we've seen that we haven't had any adverse action take place yet. But I think with the new concern being the under the threshold and being
Okay.
Medicaid, but like getting that's still something that we have to kind of take back and review a little bit further. So
I have a
sorry, I don't
case-
have like a super great answer right now, but it is something
Okay.
that we are aware of and looking into.
Yeah, Ms. Herbert, I have a case. It's not here in Nevada, this particular case. I work in 18 states. I'm on the exchange every place. Yeah, New Jersey, Florida, Georgia, Virginia, California here. Other states handle this differently. The situation I ran into just recently was a woman who has about 14,000 in taxable income, but she's got an inheritance which is not taxable, about 300,000. So she's not getting Medicaid. But if she got the tax credits in that situation, she would be paying the 100% of the tax credits back on her tax return.
Okay.
And so I've actually seen this, and that's a totally destructive situation for the consumer. Now, of course, parenthetically, look, I'm 73. I've been doing this for a number of years, and my wife's disabled, which is how I got into insurance about 15 years ago. And I'm totally outraged by all of the changes coming in. That one big ugly bill from last summer did a tremendous amount of damage, and I have absolutely nothing positive to say about it. Because I hate the concept of gratuitously hurting people for no purpose and doing things that are economically dysfunctional, simply for political reasons. But in any case, yeah, we're hurting people. We're limiting access to health coverage. The catastrophic plans don't do what the Affordable Care Act was originally designed to do, which is to enable access to preventive care, early detection of disease, lower cost of treatment, better results. And the catastrophic plans work exactly against that. So okay. Anyway, look, I'll hop off my hobby horse. I asked the question that I had. And yeah, there are people who are going to be hurt by that workaround.
And thank you for that feedback, Vic. That's something that we'll take back just to ensure, because we don't want to cause adverse action to consumers. Obviously, like, we're here to help. So that is really helpful feedback, and we hear you guys, and that's something that in a future workshop we'll make sure to provide some additional information on in a future time.
Well, the corollary from that one big beautiful bill was the elimination of the cap on prepayment of tax credits.
Correct. Yes.
Okay, which makes this a very big issue. So
yep.
Oh well.
Thank you
very much for listening.
Thank you.
Udi, we have your hand up.
Yes, do you hear me?
Yes, we can.
Thank you so much, Udi Moyal. Okay, so one quick question. Can we help with adding a baby to the dental automatically? And then we need to open a ticket just to remove the baby from the dental?
That is something that we have heard. And I also hear you guys and your frustration with that, because who wants to add a baby to a dental plan that they can't use for a while? So that's something that we have taken back. We're working with the vendor on as a wish list item to change that. So hopefully in the coming meetings, we'll have updates regarding that functionality.
Thank you so much, because I heard there is a strong policies coming for dental next year. So that's going to be a disaster if many people will choose to go off exchange to the exchange on a regular dental plan, and that baby going to come automatically. So it's going to be a lot of work for everyone. Right now, it's not a big deal, because most consumers are choosing to go off exchange. But if it's going to change, it's going to change dramatically. And that hole in that system going to cost a lot of work for a lot of people for no reason.
No, we hear you loud and clear, and we'll make sure to emphasize the need for that change. And we're hopeful that we can provide a substantive update in the upcoming meetings.
Thank you.
Vic, to answer your question in the chat really quick about the tax credits for dental, you can only apply tax credits to dental plans for children. And the tax credit has to be an overage of what you qualify for, and the difference from what you're applying to your health plan to apply to your dental. Linda, your hand is up.
Yes. I'm got a question about the qualification for the hardship. Being that we have clients who's going to, I call it falling in the crack there. They don't qualify for the tax credit on Nevada Health Link, but yet they don't qualify, they have excess income as far as the criteria for Medicaid. In a scenario like that, is it something that the client can qualify for the catastrophic? Being that, yeah, the catastrophic is what it is, but it does give the client the option of the preventive care.
I believe the answer is yes. They would just need to apply. CMS processes all the hardship exemptions for Nevada Health Link, so it's included in our current policy manual and the guidance on where to apply for that. But yes, they would, if they don't qualify for APTC due to excess income nor Medicaid, under the new rule, they should be able, if they're over the age of 30, they should be able to apply for that catastrophic coverage.
Okay, and then the timeline on that.
As far as receiving the hardship exemption,
Yes, sir.
that I don't know. Rosa or Rebecca, do you have any awareness on that?
I'm not sure on
I
that,
don't-
Joseph.
Hey, Joseph, I don't have a timeline because that's processed through CMS. It's not processed through Nevada Health Link.
Okay, okay.
Yes,
But they
the
will,
hardship's not through us.
okay. Now, with that being said, is that after it's processed through CMS? I'm just trying to get clarification. So I'm in, because you got so many, I have maybe about 10% of my clients fall in that crack, and especially the self-employed people. Um, where you deal with the income that goes up and down, just like anybody else who's self-employed. You don't know how much you're going to make until you made it. So I want to be able to do that, to explain that to them. But also with that hardship, if that person moves out of the income where yes, they're over the 250, how does that work? We have to, of course, we'll update and notify the client, okay, if this happens, this is, call me back. We have to redo the application. Am I saying that right, Joseph? I mean, am I thinking and how it's supposed to be processed after maybe they have went over that threshold for income?
So I think the threshold for income is the threshold that was given as an example. So if they're below the 100% FPL or above the 250% FPL, that's just noting that they wouldn't be eligible for the APTC or cost sharing
Right.
reductions. And
Right.
so you're saying if they went below that 250%, but they already had the catastrophic coverage, is that what you're saying?
What I'm saying is they already have, okay, say they qualify for that catastrophic. Okay, now we're kicking it, we're going down maybe in August, and now their income has went up. I'm just, because like I said, a lot of my clients who are self-employed fall in this category. So that's why I'm trying to get understanding of how to move forward with that.
That's a good, go ahead, Katie.
I was just saying, maybe we can follow up on this. We're kind of running out of time right now, so we will follow up with you and all the other questions on here. I think we have time for one more. Stella, if you want to go ahead, and then if anything else pops up after we end this meeting, please feel free to put them in the chat, and we will make sure we do a Q&A and post it by end of week.
Okay, thank you, Katie.
Go ahead, Stella.
Hi, how are y'all? And I got a question. I have a customer. He got cancel his insurance, okay, with Health Plan of Nevada because they said we didn't send the paper what we have to send, but we did. And I called Nevada Health Link, and he's active with Nevada Health Link. I don't know why or how to connect with HPN to fix this problem.
Stella, this is Tracy on the QA team. If you wouldn't mind sending an email to broker support with a little bit of information so we can look up the consumer's account and then see what's going on. We would be happy to look into that. If you can just send a little information to the broker support at nvha.nv.gov.
Thank you so much.
We'll look out for it. Thank you.
Thank you all so much for joining today. I really appreciate it. Again, if you have any other questions, please either email broker support. You can put them in this chat, email myself. We will make sure to get them filled out on the Q&A. But thank you so much for your time today and your participation. We really appreciate it. And look out for the invite next month. Thanks, guys.